Welcome to the deep dive. Today, we're getting into some health areas that maybe don't get talked about enough. The anus, rectum, and prostate.
That's right.
We've gone through some, well, pretty detailed medical info.
Yep. Chapter excerpts and the like.
And the idea is to pull out the really practical stuff, common problems, risks, things to maybe keep an eye on. Basically, get you clued in without needing a medical degree.
Exactly. Making it understandable, empowering you with knowledge about these, let's face it, pretty important parts of your health.
Okay, let's jump in. Hemorrhoids. I feel like everyone's heard of them, but what exactly are they? Swollen veins, right?
Precisely. They're swollen veins, either inside the rectum, those are internal,
Uh-huh.
or under the skin around the anus, which are external.
And they show up differently.
They often do. Internal ones, you might just see some blood, maybe on the toilet paper, but often no pain. External ones, they
Yeah.
tend to be the ones that cause more discomfort, itching, or pain.
Okay. And what causes them? Is it serious stuff or?
Often it's, well, pretty everyday things, actually, like straining if you're constipated.
Right.
Chronic constipation itself. Pregnancy puts extra pressure down there. Even just sitting for really long periods can contribute.
Huh. So symptoms to watch for would be itching, bleeding.
Itching, definitely. Bleeding, like we mentioned. Sometimes pain, especially with external ones, or you might actually feel a lump.
Makes sense. Okay, shifting gears a bit. BPH, benign prostatic hyperplasia. This affects guys as they get older.
It does, yeah, very common. It just means the prostate gland gets bigger, but it's not cancer. That's key. Benign means non-cancerous.
Gotcha. But it still causes problems because of where the prostate is.
Exactly. The prostate wraps around the urethra, the tube urine comes out of.
Yeah.
So when it gets bigger, it can squeeze that tube.
Ah, okay. So that leads to trouble peeing.
Yeah, that's the main impact. Things like difficulty actually starting the stream, a flow that's weaker than it used to be, maybe some dribbling afterwards, and needing to go a lot, especially waking up at night.
That sounds disruptive.
It can be.
Yeah.
And sometimes feeling like you haven't quite emptied your bladder all the way.
Right. Okay, now for something completely different. Meconium, newborn babies.
Yes, exactly. It's the baby's very first stool. It looks quite distinct, thick, greenish black, almost like tar.
Wow. And that's normal.
Totally normal and expected. It's a really important early sign that the baby's digestive system is working. Should usually happen within the first, say, 24 to 48 hours.
And what if it doesn't, if it's delayed?
Well, a significant delay could signal a problem, maybe some kind of blockage in the intestines, or a condition called Hirschsprung's disease, which affects the large intestine.
So it's a small thing, but a really key indicator early on.
Absolutely. Shows how even basic functions tell us a lot.
Okay, let's talk about checkups. When a doctor does an examination of these areas, what's considered, normal?
Sure. So looking at the anus externally, it should look moist, hairless, no sores or discharge. Inside, during a rectal exam, the walls should feel smooth, no masses.
And for men, the prostate check, the DRE.
Right, the digital rectal exam. The doctor feels the prostate through the rectal wall. Normally, it feels smooth, quite firm, maybe about an inch across, and it shouldn't be tender when pressed.
And what are the red flags then? What raises concern?
Pain during the exam is one. Any unexpected bleeding, feeling lumps or masses, obvious inflammation, these all need looking into.
Anything specific for kids?
Sadly, yes. Things like fissures, unexplained bruising around the area, or abnormal muscle tone could, in some tragic cases, be signs of abuse. It's something healthcare providers are trained to look for.
Awful. And for the prostate, what's abnormal?
If it feels enlarged, that could be BPH, like we discussed. But if it feels hard or irregular, lumpy, that raises concerns about potential cancer. Tenderness could mean prostatitis, which is inflammation.
So different textures and sensations mean different things.
Correct. It highlights why regular checks can be important, especially as men age.
Okay. Let's talk colorectal cancer risks.
Yeah.
What makes someone more likely to develop it?
We usually break it down into things you might be able to change, modifiable risks, and things you can't.
Okay, what can we influence?
Diet plays a role.
Yeah.
Diets high in red and processed meats or low in fiber seem to increase risk. Smoking, drinking too much alcohol, obesity, and not getting much physical activity are also factors.
Things we hear about for general health, too.
Very much so. Then there are the non-modifiable risks.
Things we can't control.
Right. Age is the biggest one. Risk goes up significantly after 50. Also, having a personal or family history of colorectal cancer or polyps, and certain genetic conditions like Lynch syndrome.
So even if you do everything right lifestyle-wise.
Your risk might still be higher due to factors beyond your control, which really emphasizes the importance of screening.
Then what's the advice on screening? Colonoscopies.
Generally, yes. Guidelines often suggest starting around age 45 for average risk individuals. But if you have that strong family history or other specific risks, you'd likely start much earlier. Definitely something to discuss with your doctor.
Good advice. Finally, what sort of questions might a doctor ask if you come in with concerns about, bowel habits or related issues?
They'll want to know about your routine. How often do you go? What does it typically look like? Color, consistency.
Huh?
They'll ask about specific symptoms, any bleeding, pain, itching, any unusual discharge.
Makes sense.
And they'll likely ask about lifestyle, your diet, how much fluid you drink, exercise habits. Family history is important too, not just cancer, but polyps, maybe even diabetes, and what medications you're taking, like laxatives.
And for men, questions about urinary changes too, for BPH screening.
Absolutely. They'll ask about those urinary symptoms we discussed earlier: flow, frequency, urgency, nighttime urination.
Right, so quite a thorough picture they try to build.
It helps put everything in context.
Okay, so we've covered a lot here. Hemorrhoids, BPH, that early baby sign, meconium, what's normal, what's not, cancer risks, and screening.
Yeah, the big takeaway really is awareness. Knowing about these common conditions, recognizing potential warning signs in your own body, understanding your risk factors,
And talking about it.
and talking about it. Don't hesitate to bring these things up with your doctor. Early detection often makes a huge difference.
Definitely. So maybe a final thought for everyone listening. These areas we often think of as private or maybe even embarrassing, they actually offer really critical clues about our overall health. Hopefully this chat helps make it a bit easier to, pay attention and speak up when needed.